Hello everybody, my name is Dr. Emery Pitcel. I am the owner of Rothrock Chiropractic and Rehabilitation. We are an office here in State College, Pennsylvania. We are continuing one of our podcast series that goes out each month, and this is on our top 5 common concepts. In the month of January of 2025, we wanted to highlight and address our management tools that we use for pregnancy. Now, pregnancy is an exciting time for mom, dad, and the whole family. Very soon, a new baby is going to be joining the entire family. So it's just exciting across the board. But there are some apprehensions, fears, and whatnot that could come with being pregnant as well too. Take, for example, that mom can easily get very overwhelmed with all the information that's out there. All the different kind of providers and advice from other people about saying do this and don't do that. It can all get a little overwhelming and intimidating. Not to mention just the very thought of mom going into delivery and having a baby. That could be overwhelming by itself. And plus, when we also consider that about 90% of women that get pregnant experience low back, pelvic, or hip pain, all of this stuff can lead to an overwhelming bundle of emotions. And that's why, as chiropractors, we at least want to be a part of that formula and a part of that success to at least help to reduce low back pain during pregnancy and hip and pelvic pain. But we also know that our techniques that we use with the Webster Technique may also reduce the chance of dystocia or difficulty during labor, long and difficult labor. So, how are we able to do that? How are we able to do it safely and controlled and effectively? That's what we're going to kind of start to address a little bit today in this podcast. So for that, I want to go over the management tools. 4 of these are going to be the tissues that we work into, and a 5th one is going to be the self-empowerment part that we bring to the table at Rothrock Chiropractic and Rehabilitation. So first, we work on the pelvic and the sacral joints. I'm going to utilize our spine model here to kind of create a little bit of an illustration, but here is the lumbar spine, and here we have your pelvis. Now, if we look at the back here, you have 2 major wings of the pelvis, and then you have the tailbone in the middle here. Now, the adjustments that we do in practice are following a predictive model of assessing the Webster side. So that's using a leg tension test sign to actually figure out what part of the sacrum and tailbone is kind of rocked up and out of place. And then that usually is going to mean that the opposite pelvis is also going to be up. And so it kind of creates like this crinkled pattern. Now, the adjustments are really soft and controlled. We use a drop piece that's on the chiropractic table and make contacts that are on the tailbone and on the pelvis to address those. Now, by fixing the alignment at the pelvis, that hopefully does take some of the pain and tension off the nerves and off all the other tissues in the area to help control that low back pain. But the other nice little bonus is we need to understand a little bit more about our anatomy down here. And by ours, I mean female anatomy. We're going to use the Frank Netter's Atlas here. And on this page, I actually want to create an illustration and understanding that the uterus is actually attached to the pelvis in 6 different spots. We have this first little stretch right here. This is called the round ligament. That goes and attaches to the front part of the pelvis. Then out to the side here is what we call the broad ligament that attaches to the side of the pelvis. And then this illustration kind of does a better job because you can't really see back behind that first one, but there's fibers that go off the back that are called the uterosacral ligament, and those are going to attach to the back of the pelvis. So then if you can imagine in our model here, we've got 2 ligaments attaching here, 2 ligaments that attach to the side, and 2 ligaments that attach to the very front of that tailbone. So by addressing the alignment at the pelvic and sacral joints, we could actually take unnecessary torque, strain, and pressure off of the uterus itself. And that is what's hopefully may give us a chance in reducing a difficulty labor later on. We kind of already alluded to this a little bit, but the second phase that we treat is the round ligament and the sacrotuberous ligament. Now, the round ligament, that's the one that kind of exits down the front. The best way to find the round ligament is to find the very front pointy part of your pelvis. That's called the ASIS, and you find your belly button. and you do 45-degree windows. It's so for a female patient, the round ligament would be right around here. And we could do a little bit of massaging pressures to take tension off of that round ligament and kind of help to reposition where the uterus is sitting in space. The other ligament that we could also work on is the sacrotuberous ligament. Now that one is on the very bottom part. It would be like a ligament that basically attaches this part of the sacrum down to about that area of the pelvis, and we're able to get in there with the thumb and kind of do some massaging pressure, and that's going to further kind of take the extra unnecessary kinking out of the pelvis down there and help a female patient feel better. Management strategy number 3, we work on the muscles as well too. So the 2 main muscles that we're going to work on with the Webster technique would be the piriformis muscle and the iliopsoas. Let's talk about the iliopsoas first. The iliopsoas is the main hip flexor. So that's the muscle that kind of runs right down through the front here. Many people don't know this, but that iliopsoas muscle actually comes up, and part of it actually attaches to the very front of the lumbar spine. So if it's tighter than it should be, it's actually going to over pull that spine into a hyperextension, hyperlordosis, which most women already are hyperlordotic during their pregnancy anyway. So taking tension out of that muscle is going to help the pregnancy, the pain with that, feel better. And also the piriformis muscle. That's kind of like the center fiber that goes right through the buttock and the glute there. By kind of doing these elongation sweeps and taking that extra tension out of the piriformis, it really then kind of helps the adjustment that we put on the pelvic and the sacrum hold better. And it does just take tension out of that area and help women feel better. So in the Webster courses, they always like to kind of hit this phrase of the addressing the bone, ligament, and muscle. So here you go. Here's the bone with the pelvic and the sacral. The ligaments are the round and sacrotuberous ligaments, and the muscles are the piriformis and the iliopsoas. Now, we also find it's really beneficial to do some addressing work at the lumbar spine. There's 2 ways that we could kind of manage it. We can use the flexion-distraction table, in which we bend the patient down at the hips and do this elongation and pulling apart of the lumbar spine to take pressure off the joints and the nerves there. That's of course going to help control some of the low back pain, take that compression that's sitting there on the lumbar spine and open it up for our pregnancy patients. And it also might really cool off some of that sciatica, especially if some of that nerve is getting pinched due to that extra compression with baby growing in there. We also find, if tolerated, the side posture traditional chiropractic adjustments can work really well to take pain response out of the lumbar spine. Now, the last piece, these first 4 were all the tissues and the regions that we work on specifically, but the last part is actually the home exercise part of it. Now, what I will usually do is I will start, as long as it's not before, let's say, the 30th week, I will actually try to start female patients with a McKenzie assessment. And if they are able generally to do a flexion series exercise until they can no longer do it due to the growth of the belly, then that actually is really good for kind of taking that hyperlordotic pain away and controlling some of that low back pain response. At some point, though, those exercises just won't work because there's not enough space to work into. And that's where we like to utilize a lot of exercises that we've learned from doulas and midwives. So things like the sacral counter pressures, hip squeeze technique, teaching clients in here how to take a bed sheet or a blanket and do a bit of like a rebozo sifting to kind of take some pressure off the belly and off of baby. Teaching patients how they can do a little bit of a controlled side posture stretch for themselves at home, how they can actually take the contact that we're finding to adjust on the tailbone and teach a partner how to put a similar pressure into those areas. Those are all similar concepts that midwives and doulas will teach patients. And we know not every patient that comes in here has access to a midwife and a doula, so we view that as kind of an obligation to pass that self-empowerment along to patients so they can have that knowledge and be able to help themselves outside of our office as well too. Because after all, that is where the rehabilitation name in our practice comes from. Self-empowerment always has to be a critical piece of any success that we have with patients. So we hope that this podcast was helpful. Hopefully it gave you a little more insight into how what we do is effective, how it's controlled and safe, it's strategic, and how we can actually help pregnancy patients hopefully decrease the likelihood of low back pain. Because remember, 90% during pregnancy will get low back pain. And then it may also reduce the likelihood of dystocia, because once again, recall that uterus through 6 different ligaments attaches to the pelvis. So by addressing all these structures, we give women the best possible chance to have the most successful pregnancy and delivery that they possibly can. From Rothrock Chiropractic and Rehabilitation, thank you for tuning in to this month's podcast. We'll see you in February for more information. If you made it to the end of the video, we appreciate you so much. Don't be afraid to drop a comment or a like. Subscribe if you found this helpful. And any sort of pregnant person that you know in your circle that can benefit from hearing this podcast, please send this information along to them so we could try to help the community more. Thank you so much for your time, everybody. Take care until next time.